Doctor-patient relationship. A fundamental part of that is confidentiality. Confidentiality meaning that anything to do with your patients, any information you have about your patients, any discussion you have with your patients, any record you have regards your patients, any interaction for that matter, it has to remain confidential between you and your patients. Even colleagues should not be privy to that information unless they are involved in the care of your patients. Otherwise, they have no reason to access a patient's record or for you to discuss these records with them. So have a look at this slide. I've highlighted key issues about confidentiality. Number one, any record you hold, any information you hold, you keep it in confidence. Number two, you do not breach confidentiality. Whether deliberately or non-deliberately, confidentiality has to be maintained. So no records, no data, no information can be breached or disseminated without the consent of your patients. Number three, do not mention your patient's detail. Anything that could identify them to anybody who is not involved in their care. So whether that's your fellow colleagues, whether that's your team members, non-medical colleagues, whether that's Joe Public, whether that's on social media, on the web, anywhere, that information should not be there at all. Now then, a few things to think about in this next slide. Number one, you discuss things in private with your patients. If you are discussing information about a patient with another fellow colleague involved in the referral pathway or in the consultation, or they will be involved in some form of caregiving, then do that in private. Do not broadcast it to people who shouldn't hear about it. You will get scenarios like this in your MMI interviews, in the interview itself. And often it involves a situation where you are at risk of kind of broadcasting information to somebody who doesn't need to know about it, or you might need to broadcast it in an appropriate way and you need to navigate that situation. You must take care in, for example, public places when you are discussing perhaps a case anonymously on social media or perhaps on a web platform. You must take care that you do not give out information in the public realm, information that should not be out there, information that can identify somebody, information that could put your patient or your colleague in jeopardy. You must dispose carefully. So records, data, all of this kind of information needs to be disposed of in the appropriate manner so that information does not leak out, information is not found by anybody else that shouldn't find it. And again, this is something we have to take into account in our day-to-day clinical practice. And also, I mentioned earlier on about social media, the web platform. This is like another world out there. You cannot kind of depreciate, you cannot underestimate the power of social media and the web platform. It is a parallel universe, a parallel world where the rules of ethics, the rules of disclosure, confidentiality, the morals and the manners in which we practice medicine applies just the same. Perhaps in many cases on the social media platform, you have to be even more careful about how you disseminate information. Remember, once it's on the social media platform, on the web platform, you cannot easily retract that information. It's often very difficult, and so you lose control. So it's even more riskier to make a mistake with regards to confidentiality on the web and the social media platform.